Dr. Ricardo Carrillo, thank you very, very much for being here at this event. As one of the only speakers here that was unknown to me personally, I can't tell you how much I enjoyed hearing you and how much I sincerely appreciated from the heart that you brought. That was beautiful. Thank you. You discussed the neurobiology of trauma,
right,
and how we get hung up in talk therapy, and we can't get past that frontal lobe.
Right.
We are big believers in honoring that truth at CeDAR, and I'd love to. Will you elaborate a little bit?
We'd love to. The teacher about the neurobiology of trauma is Bessel van der Kolk, whose recent book, The Body Keeps Score, really explains it in detail. So what happens is that when our limbic system is triggered and we're fired up, he has proven by MRIs and SPECT studies that the left brain, which is responsible for the language and logical linear thinking, is literally offline. That our frontal lobes, where we make the executive decisions, what we should do about certain situations, is also offline. Our occipital region, which is where we see things and process sight and keep the dreams and the flashbacks, is also activated. So if those two sides of the brain are lit up, the attempt for us to do cognitive behavioral therapies, really, need to wonder about that, because we're not capable of having the language, nor are we capable of explaining what's actually occurred with us. So I think a more relevant approach is to be more comprehensive in terms of being holistic, of using methods that really do the calming, the deep breathing, the actual visualization. Bessel van der Kolk likes using yoga and meditation, any kind of mindfulness strategies. We like using herbal remedies. We like using the temescal or the sweat lodges, so that the body can find some sense of equilibrium before you go to the left brain. EMDR is also very effective. However, sometimes it feels stilted. So what we've done is we've begun drumming, using drumming, mindful drumming, which is West African, or bomba drumming, which is Puerto Rican, to do the bilateral stimulation, so that, it begins to soften the distinction between the left brain and the right brain. So any technologies that we have, you can use art to do that. Let me give you an example. At La Clínica where I work, I run the grief group. Therefore, once a year we celebrate Dia de los Muertos, Day of the Dead. And what they do is they have these little boxes that they really turn into altars for the person that they've, have lost in the recent past. And so they think about it. They have the intent. They put the energy into the box, what they liked, what they thought of, what they remembered. And over time, the altar changes so that the healing is also demonstrated, that they actually get better because they're able to do that. And they're recognized artists now in Oakland, at the Oakland Museum for Dia de los Muertos.
I think that's right into the next thing I wanted to hit on. You, in the title of your presentation, and what you started with was breaking the cycle of violence, and we all think of a family system there. You and your friends are breaking the cycle in a culture. Will you talk to that a little bit?
Sure. I think it's important, and here's where cognitive behavioral therapies and family systems therapies are very helpful. I think that the very first thing I think we need to do is to let people draw their family genogram. Who are your parents? Who are your grandparents, or both sides of the family? What legacies did we learn? What behavioral patterns? Some people are chefs, some are artists, some are boxers, some are musicians, but some are alcoholics and batterers, right? So therefore, the person who is coming into treatment says, wow. And instead of saying, you know what, you're a drunk, you know what, you're a batterer, you say, you know what, you learned well. You learned from your father. You learned from your grandfather. Now you know how it feels. You know how it felt growing up. You know what it feels like now. What do you want to do about it? Then they have an opportunity to make some choices, because their children and their grandchildren are watching them. So then they can look at the legacy, okay, Now, how do I stop this? And that's where David Wexler is very good, the nuts and bolts, how to make that happen. In psychotherapy, of course, I have to do the nuts and bolts as well. But in terms of a general way of doing that, it's important to get people to understand what they've learned, get them to be motivated about affecting some change, and then help them, give them the skills necessary to actually implement the change.
You talked of disconnectedness from disconnect from sacredness. That's clearly cultural and individual. One or two real meat on the bones. Somebody feels that, somebody recognizes that. How do we start to reconnect to that sacredness?
Well, it's a two-edged sword. I mean, sacredness, you have to be ready. When you talk about sacredness, to be able to be sacred with them. So that means, we have a special relationship. Priests have gotten in trouble because they abuse their, role, their sacred role. So it's very important that when we enter into a sacred relationship with somebody who's been traumatically wounded, that we're available and present for them, but we're very respectful of boundaries. Very respectful we don't cross them. Very respectful that the intent is to empower them, for them to believe in themselves. What was most empowering for me in our men's circle was that the men allowed me, even though I was chemically dependent, even though I was relapsing, they said, you may not be able to lead us in prayer, but there's a place here for you. So that helped me come to a place that I knew was safe, where I could get some help. And so I think people need to have that, and they need to know that the goal is to really be connected. Now, one of the things that I have discovered is the one part of the sacredness work is the inner child work that John Bradshaw talks so much about. You're an adult now. Your boy, your wounded boy, was 5 or 6. Your wounded girl, daughter, was same age. What can you, as the adult, give to that child that they didn't get when you were that old? So you begin to do the healing and the empowering and showing them how to do that, and little by little they come out of that. You got to stop doing destructive stuff, stop doing the violence, stop doing the chemical dependency, stop doing whatever dysfunctional behavior. Now learn how to live in a more balanced way, and now let's do the inner child work that needs to happen for you to be available to other people around you.
A lot of pretty incredible speakers here this weekend, and the only standing O I saw thus far. And you were real, you were genuine with us, and you let us in. But I think most importantly, everybody recognized the incredible importance of the work that you're doing. So from me and from CEDAR, thanks for breaking the cycle.
Well, thank you so much for having me.